After pregnancy or major weight loss, some changes to the abdomen simply don't reverse with diet and exercise. A tummy tuck, or abdominoplasty, removes excess skin and fat from the abdomen and repairs the muscles beneath. It addresses three things together: sagging skin, separated abdominal muscles known as diastasis recti, and stubborn fat deposits. Doctors commonly consider tummy tucks after pregnancy, after major weight loss, or when aging leaves loose abdominal skin. Surgeons generally look for stable weight, good overall health, non-smokers, and realistic expectations about what surgery can achieve. Surgeons choose between mini, full, extended, or fleur-de-lis approaches, depending on how much loose skin needs to be removed. During surgery, the surgeon lifts the skin off the muscle, stitches the separated muscles together, and trims excess tissue. The remaining skin is pulled down, the belly button repositioned, and the low horizontal incision is closed with careful stitches. The first week brings tightness, swelling, and walking in a slightly bent position. Most patients start short walks within a day. Over weeks and months, swelling fades, the contour tightens, and scars slowly mature from red to a pale line. Recognized risks include infection, delayed healing, fluid collections, and less commonly, blood clots. Risks are higher in smokers. Results generally last many years when weight stays stable, though future pregnancy can stretch the muscle repair again. Did you know? You can get this treatment abroad at the same quality you'd get in the US or Europe for a fraction of the cost.
Ginger Healthcare is one of the world's most trusted medical travel companies. It helps patients to find safe and affordable care in India, Thailand, Turkey, Singapore, Dubai, Malaysia, and more. Visit ginger.healthcare or check the description for details.